Over 31,000 cases of cholera has been reported in the country. A nationwide breakdown shows that cases in 2021 has already surpassed the total case counts identified in 2020 and 2019. This will form the basis of our discussion on Sound Health this week. I'm Olasumbo Modupe. It's so good to have you on the show. The conversation begins after COVID-19 updates.
The Secretary to the Government of the Federation, Boss Mustafa, says Nigeria is expected to receive a total of 52 million doses of COVID-19 vaccines by the second quarter of 2022. Mustafa, who is also the chairman of the Presidential Steering Committee (PSC) on COVID-19, disclosed that efforts are ongoing to implement the policy on vaccine mandate for all federal public servants to ensure safety in the workplace and at homes. On travels, he said the country is exploring the principles of reciprocity between Nigeria and other nations to ease travels for fully vaccinated Nigerians. Mustafa added that the PSC would likely review current protocols laid down for quarantine, as control remains a source of worry, as well as align with existing global protocols and realities. With this decision, India has been removed from the list of flagged countries in view of improved situation in that country. Lagos State recorded 25 COVID-19 related deaths and 400 infections from September 9 to September 11. Commissioner for Health, Professor Akin Abayomi, said that 7,380 COVID-19 tests were conducted on the reported cases, from which 401 cases were confirmed positive. According to him, the 25 recorded deaths increased the number of the state's fatalities to 605. He explained that the new infections increased the number of COVID-19 cases in the state to 74,970. Abayomi said there were currently 217 positive cases in the state's isolation centers and 2,345 active cases of the infection in various communities across the state.
It is still Sound Health on Lagos Television. Speaking more on cholera outbreak is Olushola Babalola, Executive Director, Center for Environmental Sustainability and Development Awareness, SEDA. Welcome to the program, Babalola. He is joining us from Abuja.
Thank you very much for having me. Good evening, viewers.
All right, can you give us an overview of the cholera outbreak in the country?
Okay, just like you said, so far, in the last 2-3 months, it has been a tug of war in Nigeria, probably because of the pandemic. Maybe that's the reason why the outbreak of cholera has been underreported, as it used to be, in the past. But categorically, I can say that over 31,425 cases of cholera, have been reported in Nigeria, and they have about 816 deaths so far. And this is across 22 states plus FCT, Abuja. And mostly outbreaks are recorded in densely populated areas and areas where unsanitary practices, where people, takes to unsanitary, practices, like open defecation, like indiscriminate waste disposal, like doing personal hygiene. Some of people shying away from personal hygiene, as well as lack of portable, safe and clean water, in some communities as well.
How worried are you about the current situation? Because according to the breakdown by the Nigerian Center for Disease Control, in 2021, the cases in 2021 has already surpassed that of 2020 and 2019. Now, how worried should we be now?
The case is alarming. The cases are alarming. We don't need a soothsayer to tell us that if there's an outbreak in 22 states plus FCT, making that 23 states out of 36, that is more than half, of the states in Nigeria, which calls for worry, from every stakeholder, be it government, be it community people, be it leaders of thought, be it community leaders and what have you. So I think we should be worried. And coupled with the fact that that the doctors are on strike now, and that has equally worsened the situation in the sense that most of the facilities visited by some of the victims, of this outbreak could not be contained as a result of the absence of this doctor. So it calls for a worry. I'm sure the NCDC are working around the clock to make sure that they stem the tide, of the outbreak of cholera. But then I would say that they have not done much. And again, there is need for synergy, from among, stakeholders to make sure that we quickly stem, the tide of the outbreak of cholera in Nigeria.
All right. Many people are saying in some parts of the country now, for instance, in Ogun State, the Ogun State government is claiming that there is no cholera outbreak, but there is gastroenteritis now. What are the difference? Are there differences between the two? And what are the symptoms to look out for aside stooling and vomiting?
Okay, so there are two different things, just like the State said. But again, I think we should speak to the issue of testing, because to be best assured that people are suffering from cholera, so they need to perform a laboratory test. And as we are speaking, I don't think we are doing much of that, given the nature of cholera, because the incubation period of cholera is between 2 hours to 5 days. Wow. And most times, this happens quickly, and you see, what is it called? You see the effect manifesting quickly in the victim. Some of the symptoms you see are that they get dehydrated quickly. They are passing stools. In fact, the major symptoms is diarrhea. So oftentimes, some of the people that are contacted with cholera, suffer diarrhea. Some of them suffer high temperature and at the same time vomiting. So these are common symptoms that you see, in people that have malaria. But we wouldn't say that we should pass these symptoms for cholera alone. There are some other, ailments, that share the same or similar, symptoms, with cholera. But I want to say that in the area of testing people, we have not been able to do much, in that regard. The response has been very slow compared to the way and manner we approach COVID-19, during the outbreak in 2019 and 2020.
I know you pointed out some possible causes now: open defecation, poor hygiene system. These challenges that we pointed out earlier have always been at the front burner. With governments, key players have always been advocates of proper hygiene and all that. Now it's disappointing that we are still raising that issue at this age and time. Now, what is the approach to these challenges now?
Okay, I agree with you perfectly that these are social development. So and oftentimes the outbreak happen where we have low income, densely populated communities. And oftentimes when you look at the nature and character of these communities, you see that most of the communities are overcrowded and they lack sanitary facilities, just like I mentioned earlier. Some of them don't have a good toilet, and where they have, some of the toilets are makeshift and they don't take proper care of them. Then in terms of sewage disposal too, you can see that oftentimes in most of these communities, sewage are disposed which are contributing factors, to outbreak of cholera. Then again, there is need, for community sanitary practices, that actually enhance or improve, the sanitary of communities, such as clearing the bush around the house and making sure that they clear the gutter ahead of raining season. Oftentimes it's a common practice in Nigeria that when it rains, you see people dumping refuse on the sewage waste on canals, which also acts as a contributing factor, to the outbreak of cholera in Nigeria. And the situation in Nigeria also is worsened based on the fact that the amount of rainfall this year is very low, which equally aided when there is increase in temperature. This aided the vector that cause, the pathogens that cause, cholera, to incubate quickly. And these are passed, through several means, just like we have said, earlier.
Is the country experiencing response challenge due to ongoing COVID-19 response? I know you've said the ongoing doctor strike could also be a challenge now towards achieving quick response time.
Yeah. So that is one factor. Then again, in terms of response too, testing is another factor we need to consider. I don't think they are testing people as much as they're supposed to test them. Then the capacity of facilities around in terms of health centers too, it's a very big challenge to coupling or to stemming the tide of cholera in Nigeria. When you look at some of the community health facilities, they are very small, and some of them lack basic amenities that an health facility is supposed to have in terms of personnel, in terms of equipment, in terms of testing facilities, just like we said as well. So these are contributing factor to the increase in the outbreak of the cholera in Nigeria.
What must be done to increase and sustain disease surveillance on these cholera outbreak now and other gastroenteritis disease?
Okay, fine. That's a very good question. We need to put up a very aggressive sensitization information out there. People really need to know that there's an outbreak of cholera in Nigeria, and we need to tell them what they need to do in order for them to prevent, getting infected with the pathogen that cause, cholera. So one of it is personal hygiene, that we said that we need to wash, our hands often and often on a very clean running water with soap. Then another thing is to make sure that our environment is very clean. So then another thing is to make sure that we make sure that we wash our fruits and vegetables properly before we consume them. This is very much important. Then again, government need to deploy the sanitary officers, around, to enhance, their surveillance, capacity. They used to do this in the past, without cholera outbreak in Nigeria in the 80s, in the 70s, even in the early 90s. You see sanitary officers moving from one community to the other, telling people what to do in order to keep, their community clean. Then try as much as possible to sanction people too, where need be, when they, flout some of these regulations put in place by government. So we need to intensify effort in that to make sure that they deploy more officers, to sensitize people, and at the same time to watch and to see what is actually going on in different communities, so that they can quickly react, to some of these outbreaks, to the cholera endemic in various communities across Nigeria.
Are there tips to embrace, to observe before seeking help at any health facility if you're suspecting cholera?
Delay is denial, because once the symptoms start manifesting in anybody, the best thing for that person to do is to approach the nearest health facility, for the hospital to be able to ascertain in actual terms, in clear terms, what is happening to that person. Because some of the feelers from the field, was that people oftentimes mistaking cholera for malaria or even typhoid fever, and which is very bad. And cholera is one endemic, it's one a disease that kills very fast, even faster than malaria and typhoid fever. So they should not waste time. The best possible thing for them to do is to approach any health facility around and surrender themselves to testing and immediate, which is going to be followed up by treatment immediately.
Olushola Babalola, Executive Director, Center for Environmental Sustainability and Development Awareness, says that thank you so much for your expertise and insights this evening.
Thank you for having me on the show.
All right, that's all on that segment. Sound Health continues with trending health reports. Please stay tuned. This is where we drop the anchor on today's edition. Report symptoms early enough to the nearest health facility. Do not self-medicate. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.